officially start. Welcome everyone. My name is Nancy Hafer. I'm with UC Davis, the Resource Center for Family Focused Practice. It's nice to virtually see you all. I miss seeing you all in person and hope to see you all in person sometime soon-ish. We'll see how soon that is. We've got a good webinar for you today. I'm happy, excited, and honored actually to be part of this. We'll go until about 12 noon. We'll have plenty of time for question and answers. And we're also going to be doing some breakout smaller group discussions today. So hopefully today will be a good interactive time. We'll encourage you, since we were just talking about how many hours of Zoom we're all on, encourage some stretch breaks here and there, stand up, turn off your camera, move around, get a cup of coffee. So take care of yourselves as we move through the agenda for the day. As you can see, our agenda here is on your screen. We're going to do some introductions, updates from all of the state agencies. We're going to have some fun with some polling questions. We're going to spend a little bit of time talking about the background of the AB 2083, and then also, as I mentioned before, going into some breakout sessions. That will be our agenda, and if you have any questions at any time, you can use the Zoom chat window to let us know either your thoughts, if you have questions for the presenters, or if you would like for us to cover something different. So to start with introductions, I'm going to ask the California Department of Social Services to introduce the members of their team who are here as part of this technical assistance team. Ashley, do you want to start us off?
Sure. Good morning. Glad you are all joining us. My name is Ashley Franklin. I work with the California Department of Social Services under Lisa Witchy with the Resource Development and Training Support Bureau. And I'm a social worker. I've worked in the front and back end of child welfare and direct service, and then with multiple of our system, child and family serving system partners also. And I'm excited to be part of this work to bring our systems together. How about Diana? You want to introduce yourself?
Good morning, everyone. I'm honored to be here. My name is Diana Wagner, and I am a part of the Department of Social Services team. And I work in the Continuum of Care Reform Branch and Policy Bureau, and a member of the Children and Youth System of Care team, and had experience as a provider and also experience in county child welfare and mental health for several years. And just looking forward to our webinar today and sharing out information and also learning from all of you. Richard, would you like to go next?
Good morning, happy Wednesday. Rich Connect, Integrated Services Advisor, and just thrilled to be in the conversation today. Good morning. Not sure who to throw it to.
How about if we throw it to the Department of Education?
Hi, my name is Renzo Bernalis. I'm with the California Department of Education and the Foster Youth Services Coordinating Program. Very happy to be with you here today, this morning, to discuss Children and Youth System of Care. Liberty, do you want to go next?
Hi, my name is Liberty Van Natten. I'm also with the California Department of Education, and I'm the Foster Youth Data Liaison. I think that's it for CDE.
All right, Teray, how about for DHCS?
Hi, good morning, everyone, and welcome. My name is Tere Gonzalez. I'm with the Department of Health, Department of Healthcare Services, and I am in the Medi-Cal Behavioral Health Division in the Program Policy Unit, and also a member of the System of Care TA team. And I'm going to throw it over to some of our team members. Lindsay, do you want to? No.
Sure. Good morning, everyone. This is Lindsay Merwin. I also am with the Department of Healthcare Services in the Medi-Cal Behavioral Health Division. I just recently joined the System of Care team, and I'm excited to be here and excited to hear what everybody has to say. Does Matthew Lee want to go next?
Hi, good morning. This is Matthew Lee. I'm in the Medi-Cal Behavioral Health Program Policy Unit. I'll go ahead and introduce Paul.
Hello, Paul Rosinski here, Department of Healthcare Services within the Medi-Cal Behavioral Health Division Program Policy Units, working on the System of Care AB 2083 team. Very happy to be here.
Thanks, Paul. That was pretty quiet. So when you go into the breakout room, we'll do a mic check for you, okay? And how about with the Department of Developmental Services, Christine?
Hi there, my name's Christine Bagley. I'm with the Department of Developmental Services. I work in our safety net unit, specifically on system of care and supporting the regional centers in implementing their local system of cares. I'm so happy to be here. Happy that you all have joined us today. Grateful for your time, and just kind of in awe as we run down this list of our big state team, and I'm just excited to dive into conversation with all of you. Thanks for coming.
Excellent. And then we have, oh, is anybody else from DDSS?
From DDS? Nope, just me.
Great, excellent. I think I added an extra D in there.
No worries.
And the Department of Rehabilitation. Nancy, would you like to start off?
Yeah, definitely. Good morning, everyone. I'm Nancy Wentling, and I'm a manager in Department of Rehabilitation Program Policy section, and I am very excited to be here as well, and ditto what everyone else has said. For those of you that have shared from the System of Care team, I'm very excited to be part of the discussion and talk about next steps. And I'll pass the mic to Shanti.
Hi, everyone. Good morning. My name is Shanti Ezrin. I'm a Program Policy Analyst with the Department of Rehabilitation. Very happy to be here.
Excellent, thank you. So before we launch into the heavy content of the day, we're going to do one additional sort of ice-breaking polling questions. And this is, which genre of books have been your go-to during the pandemic? We've got everything from nonfiction, are you cooking up a storm? Political thrillers, I'm not sure I could handle it. We've got horror books might be in line with what's happening. Science fiction, historical fiction. Okay, lots of people are voting. And then what I'd love for you to do is use the chat window. If you've read something really good that you'd like to recommend and pass on to your colleagues, go ahead and type that into the chat window and we can see what kind of books everybody is reading. Okay, I'm going to share these results. All right, nonfiction winner. Wow, look at all the cookbooks people are reading these days. That's excellent. Okay, so we are going to continue with updates. So Christine, we're going to go through the department updates. Would you like to start us off?
Yeah, sure. So more specifically, I'm going to start with the system of care updates, just to kind of level set on what we've been up to. Just so everybody is connected, the June PowerPoint has been posted to our CHHS system of care website, and we'll put that link for that website in the chat box for all of you guys to have. That's kind of where we're storing all of our previous PowerPoints, and so if you want to check those out, feel free. Next, just wanted to kind of remind everybody about the technical assistance process. We released a letter kind of outlining the structure of our technical assistance process that's available to all of our system of care local partners. So So again, just kind of really emphasizing that that option is available to every person within the system of care at the local level. So if you're having challenges or barriers with developing your MOU generally, or a specific provision that's required by the MOU, feel free to shoot us an email and we will come together as a team to kind of bust those barriers. We also have an option for technical assistance that's kind of really child and family specific. So if there's challenges or barriers to any sort of specific case, then also you can reach out to us and we'll come together and barrier bust with you. So just wanted to remind everybody about that. And again, that's also on the same website, the technical assistance letter and the email address for how to request that assistance. Next, just kind of a reminder that the MOU deadline has been extended. No specific date has been re-announced, but again, the state's really just wanting to make sure, especially with everything that's going on with COVID, that we're just creating space for all of the local partners to really kind of create meaningful MOUs that are going to be, actually, meaningful and thoughtful. So some space and breathing room on that. So that's kind of good news. And then also just kind of to give you an update, a provision required by AB 2083 is for the state to do some work around identifying gaps in our continuum of services for children and youth in our foster care system that have experienced significant trauma. And so we've begun kind of diving into that. So more to come on that, but just wanted to kind of give you an update that we have begun looking into how we will do that analysis. And then also these, we've made the switch from Webex to Zoom for these webinars, and thank you to Nancy because she's made it an option to be able to register for the entire series. So you have when I went through, you can select the webinars you'd like to kind of pre-register for. So that is another available option. So just wanted to kind of touch base on that. So I think at this point, we're going to move into department specific updates. Since I'm talking, I'll just go into my DDS updates, if that's okay with everybody. I feel like I'm talking fast. Hopefully not too fast. So, so I have two updates from the department. One is we're really excited to announce that we've extended our START services. START is a 24-hour crisis planning and kind of linkage service that provides training to families, direct service professionals, local partners like police, hospital staff, teachers, and it's trauma-informed, evidence-based, kind of like a wrap crisis service. And so we're really excited because we started with 2 regional centers and we've extended it to 4. So it's now going to be San Diego, San Andreas, East Bay, West Side, South Central, and Alta Regional Center are all going to have START services in their catchment area. So definitely connect with your regional center if you want more information on that. So really exciting news. And then the second update is we have 4 homes that are being developed specifically for our dual agency youth. So served by the regional center and also by child welfare. So 2 CCHs, so crisis homes, and then 2 enhanced behavioral support homes. And those are going to be in the regional center of the East Bay's catchment and then San Diego Regional Center's catchment. So we're really excited and those homes are underway. So with that, I'll pass the torch to social services for any.
And actually, Christine, I'm gonna step in and we're getting a couple of people in the chat window asking you if you could repeat the sites because they went pretty quickly.
Okay.
So repeat the sites and the regional centers again for START.
Sure. So for the START services, it's going to be, let me get my list. So START services currently are in the regional center, San Diego Regional Center and San Andreas Regional Center. So they've been rolling with that. So that's already in existence. And then we've extended it to East Bay, West Side Regional Center, which is in LA, South Central Regional Center, which is in LA, and then Ultra Regional Center, which is kind of Sacramento, and they have 10 counties actually. So I don't know what it's going to look like, how they're going to roll that out, but definitely reach out to those regional centers if you have questions. And then the homes are going to be in Regional Center of the East Bay. So they'll have a CCH and an Enhanced Behavioral Support home. And then San Diego will have a CCH and an Enhanced Behavioral Support home. So that
And
those
then
are the locations.
is there also a website that you could enter into the chat window?
I can put a link for the START services, so you guys can check that out, and then I'll put in links for so really for the homes, you would need to talk to your local regional center if you have questions about that. So I'll put that in the chat now.
Awesome, thanks, Christine. Yeah. Okay, so were you going to pass it over to CDSS? Perfect.
I will give a quick mention as soon as I can pull it up of a training opportunity, and I'll add the link to the chat box. So California Institute for Behavioral Health Solutions is offering a virtual trauma-informed care training to highlight the widespread prevalence and effects of trauma, various pathways to recovery, and consolidate the knowledge of trauma and bringing the best possible collaborative care to patients, families, and staff working in helping professions. Intended to help with definition of trauma and contextual contributing factors, signs and symptoms of trauma, and components of a trauma-informed approach. That training is offered September 29th, again on a virtual platform at 10, looks like 10 to 12. And then I'll add the registration in the box. But otherwise, Christine, thank you. You covered some great updates. I'll hand it over to DHCS.
Hi, good morning, everyone. This is Tere again from DHCS. I'm going to talk to you about the Calaim Foster Care Model of Care Work Group, which is a part of the larger DHCS Medi-Cal California Advancing and Innovating Medi-Cal Reform. The purpose of this work group is to identify the outcomes for children and youth in foster care system, what the current system does to achieve them, and what changes would be necessary to achieve better outcomes. The work group started meeting in June and will continue to meet monthly. And if you would like more information, I am going to put the link, I just put the link on the chat to the DHCS Calaim Foster Care Work Group page. And I am going to kick it off to, well, Christine did hers, so Renzo.
Hi, this is Renzo Bernalis from the California Department of Education. At this time, we don't have any updates that are related to children and youth system of care.
Okay, excellent. So there are some questions that are being answered in the chat window and some websites that are going up. We're also getting a question if participants will receive a copy of the PowerPoint, which I believe will be provided. That's true, correct, Christine? Because I'm looking at you, Christine, for some reason.
So all of the PowerPoints, so we have to take our PowerPoints through a pretty extensive compliance process to make sure that it's accessible. And so in terms of turnaround time, so we'll take the PowerPoint after this, make it accessible, and then it'll be available on the CHHS System of Care website, so you can pull it down from there at any point in time. I'll go ahead and put the link to that website in the box, and you can check out our past ones as well that are already posted. So I'll put that in the chat box now.
Great, thanks, Christine. So before we move into the presentation for today, we're going to do a couple of system of care related polling questions. So the first one is, I am confident that our approach to our system of care MOU development will result in enhanced collaboration and integration efforts. Yes, no, or maybe. Okay, and then I'm trying, I don't want to pack the chat box too much, but if you have already seen some success, then you can always, we'd love to see your examples in the chat window of enhanced collaboration and integration efforts. So I'm going to end the polling. 2 more people are answering, and okay, I'm going to share the results. So 59% of you said yes, you're confident. 4% or 6 of you said no, and 37% it's unknown at this time, unknown right now. So share some of your thoughts in the chat window. Let us know what makes you confident, what some of your successes have been, and what some of the unknown, what are some of the factors that led you to mark unknown. Okay, we've got one more question, which is, which of the below agencies have been involved in your county's MOU development efforts? And you can choose all of them. So Regional Center, County Office of Ed, County Behavioral Health, Probation, Child Welfare, and then additional partners would be below. So if we could try to get as many of you to answer this polling question as possible, we'll be able to see how active the collaboration has been. So additional partners, tribes, juvenile court, fabulous, excellent. Court, lots of court, county council, SELPA, Department of Rehabilitation, excellent. Department of Public Health, great. So I've got 112 of you have answered. Can I get another 20? Let's try for another 10 seconds. Oh, a couple people did. All right. Okay, I'm going to end the polling and share the results. So you can see the County Behavioral Health has been the most most active. Child Welfare, Probation, County Office of Ed, Regional Centers. Do any of our partners that are on the call have any thoughts or comments about this? Christine, Teray, Richard, Renzo? Is this about what you were thinking?
This is Christine. I would say, you know, in my kind of conversations with everybody, this seems pretty reflective of kind of the feedback that we've been getting from the field. And, you know, in a lot of ways, this is really exciting to see all this collaboration happening. And I think it's great for everybody to also see the visual of like where there's areas to kind of pull some of our other partners in and lean into that. So this is great. Thanks everybody for sharing.
Great. Okay, I am going to now introduce Diana and Lindsay to review and talk about AB 2083.
Sorry, I almost didn't unmute myself there. Okay, so I'll just dive right into this slide. As many of you already know, the AB 2083 was a legislative bill that passed in 2018. The intent of the legislature in adopting this bill was to build upon the current CCR implementation effort by developing a coordinated, timely, and trauma-informed system of care approach for children and youth in foster care who have experienced severe trauma. The bill requires each county to develop and implement a memorandum of understanding, an MOU, setting forth the roles and responsibilities of agencies and other entities that serve children and youth in foster care who have experienced severe trauma. The team has developed MOU guidance to assist counties. The guidance is currently posted on the California Health and Human Services Agency website. We have worked with our state and county local partners to better serve children and youth who are receiving services from multiple public programs. Our goal is really simple. Our programs must meet the needs of the children and youth that we serve. These are our collective children, and they all deserve the very best. We do recognize that it is our obligation to ensure that the services we are providing are coordinated, as I mentioned before, timely and trauma-informed. We must all come together as one government to break down the silos and build a culture that is focused on delivering services that are person-centered rather than program-centered. Can we go to the next slide, please? All right, so these are the county-level deliverables. As mentioned during the previous slide, the MOU guidance is posted on the CHHS website. The state interagency team has released all county letter 2063, which describes how counties and local partners can request technical assistance. The team is currently working on the gap analysis and the multi-year plan. However, the timeline for the release of this has been impacted by COVID-19. Can we go to the next slide, please? Thank you. So this is representative of the connection between county interagency leadership teams to the state Child and Youth System of Care TA team, which is made up of the following agencies: Department of Developmental Services, Department of Healthcare Services, Department of Social Services, the Department of Education, and last month, Department of Rehabilitation has now joined the team. We're really excited about that. There are designated AB 2083 staff within each agency that currently meet twice a week to develop guidance and provide technical assistance, such as this webinar. And I'm going to pass it on to Diana for the next slide.
Thank you, Lindsay. So the mission of the State Technical Assistance Team was identified by the California Health and Human Services Agency in partnership with both state and local partners and stakeholders along the way. And so really, Christine spoke to what we're here to do in our updates, but just as a reminder, we're really here to promote collaboration, not just at the local level, but also at our state level. Increase that communication across systems in order to meet the needs of children, youth, and families. I can't emphasize enough that piece of increasing the communications as a part of the technical assistance calls on child-specific cases. Really, if we boil it down to a single spot of simple improvement, it would be around that communication between the systems that are serving the children, youth, and families. So the next one is supporting timely access to trauma-informed services for children and youth. And really, I think that our goal is to immediately provide services to the children within the foster youth system. We also want to do those technical assistance requests by counties and partner agencies to meet the needs of the children and youth for specific cases, and also to help local county system of care develop their plans to best serve their particular county and systems. Next slide, please. So again, some very basic pieces here, but with the MOU development, making sure that you consider all youth are our youth. And again, it's that piece of with the technical assistance calls and paying attention to the communication that's happening at that local level between all the partners serving the children, remembering that at the end of the day, that child lives within your county. And it's really important to consider it as our child. The sharing of resources requires the development of collective responsibility for each child that allows for a collective decision-making process where all partners are equal and share in the outcomes. So that really sharing that responsibility is important, and sharing in the outcomes of that success, we give those over to the children and families. Collaboration is not the same as integration. An integrated team relies and counts on each other. A collaborative team communicates every now and then. And so really increasing to that integrated work together at that local level. So don't let perfection be the enemy of good. So, you know, if we think about things that we've developed along the way, we usually have a version 1, version 2, version 3. Remember that as you're developing the MOU, is that let's start at our baseline and continue to develop that MOU to really be a tool that the county and local system of care can use to better serve all kids within your community. So unlike some MOU documents, System of Care MOU is about alignment. It's not about legal compliance. So make sure that as the integrated leadership team, you work together to create a system that's going to work best for the children and families that you serve. And I would say at the very end, bring in those attorneys that are going to help shape it. But it really is about aligning your systems to better serve children. Next slide, please. So this is really just a visual of some of what I talked about in the last 2 slides, looking at how the leadership and the policies can be shared, how there can be joint authority, joint funding, joint decision-making, and problem resolution across all these different departments at your local level. The management, measure the key outcomes for all children and families. Share that information so that you are making data-driven decisions. In the practice, work together to address the full set of the family's needs across all departments. And the community, this is an important piece. Partnering with family and consumers and their supports. Sometimes their natural supports have answers that we cannot begin to develop, and relying on them to be a part of the solution for the family is important across all of our departments. Next slide. So we are getting ready to go into our breakout sessions now. And I just want to remind everybody that during the breakout sessions, we ask that you remain muted and use the thumbs up feature in the participant section to be called on to talk, or use the chat function to share your ideas. We encourage participation during the breakout section to create peer-to-peer learning and also further the development of the MOU process. There will be a timer that will come up when there are 60 seconds remaining for the group discussion. And we are going to go ahead and head to those breakout rooms now.
Okay, so give us a few minutes as we send everybody to the breakout room. So Calaim, you ready?
Yep. Here
Okay.
we go.
Good luck, everyone. Have fun.
Hey, I got sent to
Yeah.
room 2. Can I get back to 3?
Yes, I'll put you guys in there.
It's
And
working.
I got sent to room 1. I need to be in 2.
Yeah.
I got put in 3. I need to be in 4.
I had to do that again, or else I'd have to put 300 people in manually.
Yeah.
Oh, yeah, no worries. I mean, at least we got back to the main room.
I know.
You know?
Yay.
All right, here we go.
You need to be in 3, right?
Yeah,
Yes.
I think, yes,
Yes.
3.
All right, give me a second. It looks like this list is huge, and I have to actually scroll,
Oh, sorry.
find everyone. Well, actually, let's see.
Hello, sorry, I was sent to room 4. I think I'm supposed to be in room 5 with Tere.
Or okay.
We're playing musical rooms here.
We're getting you in there.
We're getting there.
No problem. Not trying to be a squeaky wheel.
Matthew.
Everyone's so needy.
This is one of those natural stretch breaks for the attendees.
Exactly.
I'm going to call that out when we get back in there.
All right, Richard, I got you. Room number 1.
Hey, can you all hear me?
In 3.
Not really.
Pretty low.
Yeah, really low, Renzo.
So that was actually Paul. By the way, there's nobody facilitating in room number 2 right now. So
I don't think there's anybody in any of them.
Yeah,
The
I
link
just sent a
sent out an
message
email
out.
to everybody.
Yeah, so they know just to kind of hang tight. All right, let's see. So Richard, what room were you in? So I could
1.
just look.
1.
You're going to 1. What do you remember which one you're in? It's
1.
1.
Okay. Oh, there you are. So you're actually good for 1, so you can go back to 1. And I'll send Ashley your way into 1. Yeah.
Richard, do you already see your join button? Click on more and you'll see a join room button under more.
Then Ashley, is Ashley here?
No.
It shows me going to 3.
It shows you going to 3. That's weird. It shows you in here, Richard.
So I came from breakout room number 1, and I think I saw Ashley in there, but I think I'm supposed to be with Liberty in breakout room number 4. So I left the room.
Yeah.
But Ashley should be in there. I saw her.
Okay, so Richard, it says, I don't know, on here it shows that you should be in 1. So I'll just put you to 2, and then I'll move you back into 1. So just hang tight. All right, let me take care of Richard first. Okay. At least it's in alphabetical order. Okay, so he should be in 1 now. Yeah, okay. So now we need Ashley.
I think Ashley's where she's supposed to be.
She should be in 1, 2. Ashley Frank.
Yeah, Ashley was in room 1.
Okay, so she's good. All right, Renzo. Let's see. What room were you in, Renzo?
Number 2.
2, okay.
Still need 1.
Do you want me to select join breakout room now, Calaim?
I'm sorry?
Do you need me to select join breakout room now?
It has you selected as 2?
Yeah, I should be going to number 2. I haven't gone in. Do you want me to do it now?
Yeah, if it looks like it'll send you to 2, then yes.
It still has me going to 3, guys. I got to be in 1 with Ashley.
That's weird. On my side here, it showed that you were in 1.
Yeah, the same thing's happening for me. Maybe I'll just go in and let Ashley know that I'll be facilitating that room with her, and that way we can get started. Does that work for you, Richard?
No problem. Do you want me to go to 3?
Yeah, I think that maybe that might be the easiest way to do it. Does that work for you guys at UC Davis?
Yeah, totally.
So Christine's in 3.
Who's facilitating 2?
I'm supposed to be in 3 with Nancy.
Let me try to put you in there, Christine.
Do we have anybody in room number 2 to facilitate if Renzo's going to 3?
Tere's in room 2. I'm supposed to be in whatever room Tere's in, but I thought we were supposed to be both in room 5. So.
Let me see. Yeah, it still shows Richard in room 1 on my end. That's weird. All right, let me just go down the line. That'll be the easiest way. So Christine, which room did it show that you went into?
2.
So 2. So let me find you on here. Christine Bagley. Okay, yeah. And you're going to room
3.
3. Okay, let's try it. Here we go.
Okay.
Christine,
Yes.
I'm trying to catch up with you.
Sounds good.
So you should be going there now.
Yeah, she went.
Okay, she's gone. All right, and then Nancy Wentling is with
Yeah.
her.
So yeah, so it says I'm in 4, but I'm supposed to be in 3.
Okay. Let's see.
Thanks for your patience with this, you guys.
I was just going to say
It's
the
just,
same
it's
thing. Thank you.
scrolling through the 300 names that makes it challenging.
Rolling with the
All right.
punches.
Here we go, Nancy. You're going. You're sent
Bye,
out
good
now.
luck.
Bye.
All right.
It's like
Matthew.
a Willy Wonka and the Chocolate Factory thing, right? It's like a good egg. Whoosh. There you go.
Yes, Tere, I think, is in room 2. I'm supposed to be her note taker for whatever room she's in. So if you guys want to leave her in
He's
2,
in
that's
5.
fine.
What room did it throw you in originally?
4.
Okay.
So Richard is in room 3 now.
Oh, you're back.
I'm back. So Richard's in room 3. And that's, I mean, at this point, I think as long as we have a facilitator in each room and a note taker in each room, it doesn't really much matter. But I probably shouldn't be in a room with Richard. So, I'm happy to go wherever, but.
So it sent you, but okay.
You sent me to the right room, but Richard is in the wrong room.
Okay,
Yeah,
let's try to
I
move
think
him again.
Richard was supposed to go to 1, so maybe Christine, if you go to 1.
Yeah, perfect.
Sounds good.
Yeah.
And Allison and Juan and James and Tristan
right.
have some patience with us, and we'll get you guys put into some breakout rooms here pretty shortly. We're just making sure facilitators get in the right place at the right time.
All right.
Well,
Hey, this is Paul. I'm supposed to be in the room Renzo's in for note-taking purposes, but I think he's in a different room now. So
Okay.
whatever room needs a note taker, I'm happy to step in. And
So
Christine, you're muted.
everyone, this is Shanti. I just did an experiment myself. I went to a breakout room and I was assigned to breakout room number 1. But once you're in the breakout room, you can click breakout rooms and it gives you the option to hop between rooms to another room. So once you're in the breakout room yourself and you need to be in another room, just go ahead and hop into the one that you're supposed to be in, and you can do that yourself. And it says the host moved me into that room. So through that method, I was
Cool.
able to move from
Oh,
room
wow.
1 to room 4.
Okay, I'm gonna check out because Renzo's rocking and rolling in room 1
Okay.
already. So him and Ashley are moving along in room 1. So we know we probably shouldn't go there. Richard was in room 3. Who's in 4 and 5, I guess, is the question. Matt, what'd you say? What's up?
Muted.
There you go.
Matt's supposed to be in 5. You're muted.
You're
Where's-
muted. Matt.
And where's Nancy?
And Nancy, she's supposed to be in 3. Let me look for here.
Tere's not in 5, so I just go to 5 then and back her up, or
yeah.
or go to 2, because my boss is blowing me up saying she's in room 2. So I don't know what to do.
Is Tada's in room 2?
Yes,
And she wants you in there?
I think so.
And that's where you should go.
Okay, can someone assign me to room 2 then?
I'll assign you to room 2. If it doesn't put you into room 2, someone else mentioned that while you're in the breakout room, go to the bottom. You'll see a breakout room button, and then you can hop into room 2 from there.
Yeah, I see the breakout rooms button, but it just says I'm assigned to room 5. It won't let me choose like room 2.
It should give you more options once you're in the room, from what I was just told. Let's try that.
Okay, so you want me to go into room 5 and then try and go into room 2 from there?
Yeah.
Okay.
Let's try that.
All right. I'll try that.
Calaim, can you just throw me into any breakout room?
Sure.
And Nancy, you're muted.
Breakout room 4 is doing great. And
Okay.
so I'm going to ask James, Juan, Tristan, Gina, Brenda, Maureen, and Yvonne, Mark, if you all are trying to get into a breakout room, if you chat me, I'll be able to send you into a breakout room. So just chat me. We're doing some other troubleshooting, and that would make it a little bit easier.
Nancy, should I send pretty much all these folks back into breakout rooms? These are the
Mark, yes.
okay.
He represents the County Office of Ed. Does he need, and it's a random selection, send Mark back to a breakout room?
Okay. Gina as well?
Brenda would like to go to a breakout room.
Okay.
Maureen would not like to go to a breakout room.
Okay.
Hey, real quickly, this is Paul. Does anybody know which room still needs a note taker? Because I think everybody's kind of shuffled around, and
yeah,
the room I was supposed to be in has already got a note taker in it.
See if I can look.
Oh, Maureen is okay with going back. So Maureen, you can just go down. There's a button that says more with 3 little dots. Click it, and you should be able to join the group back again.
So you were in 2, Paul? Let me see if
Yeah, I was. However, it looks like they already got a note taker there. So, do we know which room still needs a note taker?
Nope.
Everybody got shuffled around.
I'm pretty lost.
Likewise. Okay.
Actually, let me see if Richard.
Thanks for your patience, Paul.
Yeah. No, I mean, yeah.
In there, actually.
It does work great, by the way, as a co-host. When you're in a breakout room, you click the breakout rooms button at the bottom, and you can move to any of the.
Oh my gosh.
Yeah.
Okay.
So Paul, were you able to see that?
I'm sorry, say that again.
If you go back into the breakout room, you can click the breakout room button on the bottom of your screen, and then it'll allow you to jump between rooms.
Okay.
So Paul, why don't you do that? And Lindsay, why don't you do that too, and just go find a room that needs some help?
Got it. Okay.
Yeah, that'd be the easiest.
Yeah. And then Tristan would like to go back to group 1. And Tristan, if there's 3 buttons on the bottom right, you should be able to hit it. It says more, and you should be able to just say join group. It should take you back to 1.
Okay, I was supposed to stay in the main room, but I'll head into a breakout room.
Oh, you don't need to stay in the main room. Sorry, you can stay in the main room.
Are you sure?
Oh, totally.
I don't, yeah, because I can go help whatever needs to be done.
I think everybody's good. I just thought you were looking for a room to go to.
Nope. Me and Diana. So I don't know where Diana is, but we were both supposed to stay in this main room, I thought.
Okay, so Tristan, Yvonne, Elizabeth, and Susan, would you all, so Tristan is trying to get into breakout room 1, Calaim.
Tristan, okay. There we go. And Elizabeth and
I'm just going to do a quick check-in to some of the breakout rooms and see how they're doing. I'm just going to pop in. Is that okay with you, Nancy?
Yeah, totally. Hi, Elizabeth. So Elizabeth needs a breakout room.
All right, here we go.
Elizabeth, we're in breakout rooms and we're assigning you one.
She goes.
Can I send Yvonne also?
Yvonne, would you like a breakout room? Hey, Allison, can you talk? Are you there? Hey, can you make me a co-host, Calaim? I'm not a co-host.
Yes.
Oh, hi.
Hey, Allison.
Multitasking. Hi, James. Hi, Joe. Hi, Calaim.
Hey.
Look at the dream team of people trying to help figure out these
I
facilitators and
know.
breakouts.
Yeah, I was in a breakout room and everybody was just like, so
what do we do?
So I came back here because I was like, maybe there's a glitch. And then.
Oh, got it. And did you go back and tell him to?
No, because I don't know. I can't get back to my breakout room, so Lee would have to put me back in. So.
Would you like to go back?
But I don't need to go back to one.
Okay.
I was going to say, Allison, do you remember which one it was?
No.
Well, I think if you go to the more button, you actually could go back, right? Let's do that practice.
It literally doesn't matter. I'm kind of just listening with one ear and doing some other stuff, mostly just kind of to stay in the loop on what's happening with AB 2083.
Yeah. All right, cool. Okay, well, I just wanted to say hi.
All right.
So we learned.
How long are they going to be in their rooms?
Nancy, the 10-minute timer, there was like a little timer or whatever. I just turned it off until you tell me
Okay.
Since we had a bit
Oh,
of
they asked for 25 minutes.
Yeah.
Anybody catch when we went in? Ooh.
And Joe, I literally assigned like Richard Connect. I assigned him to breakout room 1, and it showed that he was in 1.
Right.
Out, and it kept sending him.
Yeah.
He was for like a second. I
Oh,
must
really?
have been in 1, or he would like popped into mine for a minute and then he was gone. So
Yeah.
Okay.
Little side note, Zoom released a new update and now you can do this.
what?
Oh, wow.
Augmented reality.
There we go. Yeah, keep that one. Yeah.
Oh my
There
gosh.
we go. There we go.
So funny. That is hilarious.
That is funny.
So funny.
Hey, that'll help out some family gatherings on Thursday nights and what.
Yeah.
That is hilarious. All
Hey,
right,
but
so
guys, we did learn 2 important things though. Number 1, if we do this again, we probably just need to tell all the panelists at the get-go, go into the room and then push leave, and then we'll start you off from this main page. And second, if you do go somewhere, as Joe just told us, it sounds like it's easy for a co-host to jump into another room. That's awesome.
I guess maybe we should just, since they know what room numbers they're going to go to, they can just jump in their rooms. That was the thing that we couldn't figure out.
Mm-hmm.
hey, Joe, you're sharing your screen.
I'm sharing slides as a virtual background.
Nice.
Oh, whoa.
That's a beta feature. I just wanted to see what it looked like.
That's trippy.
Yeah.
That is. That was wild. Your guitar showed up a little bit.
Yeah, it likes that red, I think.
Yeah.
Well,
Okay, so how much time do they need? Are we at 10-minute warning? Allison, if you want to go back to multitasking, you can.
I do, but for some reason not. Oh, there we go. Yeah, I'm in a multitask, but I'm here.
I was
Okay.
going to ask, should we
Thank you.
jump in there and kind of see how it's going?
Yeah, did you make me a co-host?
Yeah, it looks like you're a co-host.
Okay. Was I a co-host?
Yeah.
Because it didn't give me the option to join different breakout rooms.
Were you in one?
You may not have been assigned to one.
I was in one.
You were in one, and then it.
Here, I'm going to go see. I'll be right back.
Okay.
Claire O'Connor, that looks like a new person. Lauren Basil.
I can add them. I'll send them.
Yeah, this is definitely good to know for, the future. I mean, this scenario.
Right back, guys. I'm gonna just check the rooms real quick. Well,
Oh, this looks like a new person coming in.
actually, James, do you want to just check the rooms, just to make sure everything's? You're muted, Nancy.
Yep, it totally worked. That was awesome.
One thing we might think about when there are different roles like this, people have different roles, note taker, facilitator. We might ask them to actually add that to their rename. We could rename them, or they might be able to rename themselves to make it easy to identify, that person, to help split it up.
Yeah, because it was tough. It's tough going down this list and trying to figure out. I have
Or
the original
you
list
could
on the
ask,
right.
you could also do something like have all those people put a 1 in front of their name, or you put a 1 in front of their name.
Yeah,
so
that's
they're
a great
always
idea.
up at the top.
Yeah.
Yeah, because I'm assuming this group will want to do breakouts again in another month. So
And
that's
we're-
a fabulous idea.
And we're learning a lot about just the practical side of it, right? Like this.
Yeah.
Yeah.
And this is one of those things where you really don't know until you put 300 people in the Zoom
Yeah,
room.
you're just not going to know what are the issues until you try it.
Yeah.
Right.
No, you guys, thank you so much, James, Calaim, and Joe. So I just went into 2 breakout rooms and they seem like they're doing fine, except we should give them a time warning. We should let them know how much longer they have.
Okay.
So should we give them a 10-minute warning, or what was the timer?
Well,
I'd give them at least another 10 minutes because it took so long to get everyone settled.
Since it kind of started.
Maybe 15.
But what is it? What does it say in the breakout rooms?
Right now, it's just off. I had
Oh,
to turn
okay.
it off. Yeah, I had to turn it off.
Okay, so I will.
We could send out a message, or Salim could send out a message to all the breakout rooms that says we're going to end at 11:15 or something like that.
Okay, give me a minute. Let me go into one of the breakout rooms and chat their person,
I'll wait for
and
you.
I'll be right back before we do that. Okay.
Yeah.
Okay.
Did you guys see that explosion in Beirut?
Oh my gosh.
Oh, it's like, ugh.
Man, you know, my first thought was somebody's lying. That was really powerful. And they said it was what, fertilizer?
No, it was the. You remember what it was? A friend wrote me, but it was the same stuff that the OKC bomber used.
Oh wow.
Yeah, see, that was fertilizer. He used some kind of mixture between chemicals and fertilizer, and put it all together in a van.
So Yvonne's back, Matt's back.
Am I the only one that just got dropped? Because I just lost my connection.
Oh, okay.
Yeah, I need to go back to room 2, please, if possible. I don't see an option.
Did you have to come back into Zoom, or did you just get kicked out? Okay.
No,
so you got kicked out entirely.
Okay.
And Yvonne maybe too.
Yvonne might be a new entry.
I think she was here before.
Or did you see her name before? Okay.
Because I wasn't sure if someone came back out, and I sent them away, and then they came back out again. I just keep sending them back. But oh well.
So we've had this recording going the whole time.
Yes, I'll have to.
We'll probably want to edit it. Yeah.
And how does this otter service work? Because I saw that it's like transcribing right now on the website.
I would actually stop it and start it again when everyone comes back. It'll be
in the breakout room.
Okay.
So I think you guys are the only breakout room in this main room. So you all could continue here talking. I think we're gonna, Salim, I think we could give everybody like 7 minutes, a 7-minute warning.
Okay.
Our countdown ended, Nancy.
Did
so
it?
I was trying to go by my watch.
And so where did you, yeah.
Yeah, I was noticing that in the other breakout rooms too, that their countdown had ended. We can go in and maybe let them know that there's like a 5-minute warning. You want us to do
Salim
that?
can just send them an email or a chat that says you've got 5 minutes.
Perfect.
Yeah.
And
then
Nancy,
Diana,
this is
if you want to continue with your group in this room, you can just use this.
So yeah, so the folks that and I'm still interested if Allison, if you happen to be here right now, just the lessons that you're learning currently. And Allison, because you get to talk with other folks in various counties, I'm just wondering if you are hearing about any lessons that are being learned in this process. And I would encourage anybody else that is in our group right now to talk about that also.
Hi, Diana.
Hi.
The main thing that I've heard, we had a recent meeting with, I think it was a managers meeting, not a directors, but people were saying that at first it felt like the ask was really about creating this MOU, and what counties have realized is it's so much more than that. Like it's really about how they are reinventing their work across systems and really looking at those partnerships differently, and that's good. And it's much more work than they anticipated. So it's good that they're having that bigger picture lens about what really the ask is, like to not just create a document. It's not about just an MOU, but really how are we integrating systems, and that is a much more intensive process than they anticipated.
Thank you. Thank you for sharing that. other folks that are in here? Judy, are you there?
Yes, I am.
Judy, can you share a little bit about what you're experiencing currently?
Oh, Diana.
Thank you for letting me call. I'm just going to say thank you so much for letting me call you out, my friend.
No, I think that the point around, it's really not about the MOU execution really resonates with me. It's much more about really wanting to come together around, value and principle-based way of, doing business. And that is a huge lift when you're looking at multiple systems, because, many of us are at different places in terms of, the recognition that, the way that systems have been designed is not necessarily always, family oriented, right, in its approach.
Right.
And so, we, I think I continually go back to, the wanting to have the conversation around what do we want services for kids and families to look like in Ventura County, not just what we want, how do we want the MOU to be, or how do we want child welfare to, respond, or how do we want mental health to respond, but really, the idea of point of entry, right? Because we know that families that come into a system, maybe through the school, behavioral health school initiative, may be very well known to child welfare. And yet, the way that things operate, we usually wait until it comes, gets bad enough for us to intervene. And so, how is it that we could really come around the family in a proactive way to, even prevent bad things from happening? And that, I know that's not the intent of 2083, but I think that for me and for many of us at the table is kind of the rub, right? We don't want to just create a system that focuses on families that are already in care, but when do we get a chance to look farther upstream? So I think that the time and the sometimes challenging conversations that we have around values and principles is very worthwhile in that respect, because we've had many MOUs, and so my commitment and my pursuit is in having more of a design than an MOU.
Thank you for sharing that. That was such valuable information, Judy.
Yeah, sure. I don't know if it really helped us in moving that 2083 forward, but I think it's the reality at the operational level, right? I mean, as a system, do we really want it to look differently, it meaning the system, do we want it to look differently in terms of how we are serving kids and families? I do, and that's the message that I continue to promote, because I think the system as it is right now is giving us the exact outcomes that it was designed to give us. And so, especially right now in this time of, increased awareness around, social justice issues, I just believe that we are at ground zero, for really being able to question the way that we are doing business, and to do, more importantly, to do something about it. And so that's where my attention is right now.
So I understand what you're saying about the piece of 2083, but I think you just spoke some very powerful words. And it touches me, it resonates with me, and I think that's the attitude that really, I hope every integrated leadership team, when they come to the table and they sit down, they look at it and have that in the forefront of their mind in this development, because it's more than just this piece of paper that you turn into the state. It is about those connections and the relationships. And really, I like what you said. What do we want services to look like? Not from an individual department level, but really at that that collective level within every county. What do we want the services look like for children and families? So such powerful words, Judy. Thank you.
And it looks like the other groups are maybe starting to join us. We've got one additional group here, at least.
You're coming in now, Nancy.
Okay, great. Thanks, Calaim.
You got it.
I was just going to add, Diana, for me too, yes, it's about what the services look like, and it's about like, what is the family's experience with our system, right? Like not just the service piece, but like, how do we design the experience for the child, youth, and family with our systems such that we are all operating from a similar place of values and beliefs and principles with which we're approaching them, and everything is trauma informed. And so not just the service delivery piece, but how are we really creating systems that craft that family experience, and where we also have a climate of healing across all of our organizations.
That was a good addition, Allison. Thank you.
Okay, welcome back, everyone. Good. Here y'all come. Okay, welcome back, everyone. We are going to now just do a quick report out and debrief from the break. So I could show my slideshow again, but I think for this it might be nice to be able to see people's faces. So I'm going to not share my PowerPoint for a few minutes and just let people connect this way. So let's talk a little bit about the breakouts and what was discussed in each one of them. So we can, and thanks for your patience. This was our first time doing such a large group with so many facilitators, and so we know that the facilitators took a few more minutes to get to the breakout rooms than what we had anticipated. But breakout room, would you like to recap what was shared and discussed?
I'll share. So I feel like we could have used more time. We really started getting going, so I think that's a good kind of reflection from our group, a takeaway. So once we started kind of digging in a little bit, something, a kind of barrier that was identified was, you know, the kind of discrepancy between like who's drafting and crafting that MOU, and then kind of the boots on the ground that are implementing the MOU, and kind of the identification of, you know, we're all really aware that our systems are siloed, but that there's also kind of silos within our own agencies or departments, right? And so, so how do we take this MOU that's been crafted or developed and connect that to the people that are going to be doing that work, and making sure that there's a bridge between that. And so I think that was a really kind of great takeaway from our discussion today is that linkage between those two kind of levels.
Excellent, thanks, Christine. How about breakout group number 2?
Yeah, so we got going towards the end as well. I think a little bit of that was due to having a little bit of technical difficulties at the beginning, but we had quite a bit of participation through written comments in the chat itself. And while we may not have gotten to the level of detail that group number 1 did, we did have within the chat and within the examples that were provided to us by group members that participated by speaking, that we were hitting on that distinction between the ILT being able to define the, not the difference, but how to have that coexistence between the mandate to actually develop and write the MOU and utilizing the relationships that are being born and augmented through the ILP team membership, affecting how the day-to-day work goes. So we had a little bit of a discussion about, for example, whether or not specific individual information was being shared within the ILT at this time, and heard an example from a county about how their ILT is providing at this time a bit of a problem-solving space for difficult situations, but within the ILT itself, they're not necessarily sharing individual information. What we also did here is that the counties that were within our breakout room have identified their ILT members, and most counties are engaged in currently meeting. Some counties are further along than others, expressing that they've already have drafts of their MOU that they're reviewing. But across the board, the biggest barrier for all really boils down to time and availability for individuals to be able to meet. So it hasn't been a barrier from the sense of a lack of any one particular partner wanting to be involved in the engagement process. Across the board, what we heard was excitement, and across the board, what we heard was an appreciation for being able to get together and to develop relationships between different county agencies, but more importantly, between individuals. Ashley, is there anything else that you want to add to that that I may have missed?
Yeah, I think from our group, I really appreciated the tips and tricks about what was happening and how folks were making it work. And I think I heard that some folks have a solid ILT in place and others are really looking to expand it even further, or recognizing that there are other partners they want to bring in, and looking at their MOU process as not only the technical pieces that it really establishes, but the relationship building and how that impacts the care and the offline conversations that happen to help those individual kids that you might not be talking about name-wise in your meetings. And then that like ongoing evolution of the MOU being that you're at a starting place, and that you'll continue to build your partnerships and expand those, and make changes to the MOU where it makes sense as you move along in those relationships.
Thank you, Ashley. Nancy, I think we're done.
Okay, group number 3.
So good morning, and thanks to the group members, and particular appreciation to Nancy at DOR for co-hosting with me. So we had a nice little discussion. I think probably 2 of the highlights for us. We talked about the membership of the interagency leadership team as a kind of a key MOU element. And we talked about the imperative of kind of focusing that on the core membership that's obligated under 2083 and not getting too expansive. We want to have a meaningful group that can get work done, really, is the balance point. And it's hard to reach in some situations, but focusing on the core membership and then building from there, maybe in future iterations of your system of care development, your MOU development is pretty critical. The other 2 other elements actually we talked about integrated corporate practice model a little bit. There was a nice inquiry about how ICPM can apply to other systems, and I would just remind folks we're going to talk about that in a deep dive next month, so be sure to tune back in next month because we'll get into that. The third element we talked about in group 3 really was about how you find the balance between investing in the alignment and pursuit of kind of shared mission and vision, while also getting that MOU done, because there's a fair amount of heft that's required just to get the words on paper. And so we talked about the barometric, if you will, kind of balancing that early alignment, mission, visioning work amongst partners, and how critical that is, because at some point in the MOU construction, if there's conflict, which is inevitable, if the alignment's not there, then the MOU unravels pretty quickly. The partnership can come undone. So just empowering ourselves in our local conversations to invest as much as needed in aligning the purpose, intent, the shared nature of our work with young people and communities. So those were really the three things we, I think, spent most of our time on. Nancy, did I leave anything else out or anything you want to elaborate on?
Nancy, I think you're muted.
Sorry, I was just talking to myself. So yeah, so Richard, you pretty much captured most of it. What I was saying is we did have a little discussion about acknowledging the challenges related to navigating technology and building relationships in a virtual world versus like sitting in a room together, and that there are some equity issues and challenges to address related to access to telehealth and internet and just bridging the digital divide. And I think then the other part, just to add a little bit on to the ICPM, there's some discussion about kind of needing to get all the different partners having more information or knowledge about utilizing that and what's involved in the whole model. So I think that's pretty good recap, Richard.
Good, Nancy, thanks so much.
Sure. All right, group number 4.
So I'm not sure if that was supposed to be me because my room number said 2, but I can go next. Did from DHCS again. I think one of the things that resonated with our group was the reprioritizing of a system of care due to the COVID-19 sort of state of emergency, where it's not a reluctance to do the work. It's that everyone is kind of pulled in different directions now. Budgets are also pulled in different directions, and there's a lot of unknowns of what the availability of certain budgets would look like for some of these efforts. Also, in relation to that, that meeting with some of the partners might not be as easy anymore because folks are focusing on COVID-related items, and although some people were making good headway, right before COVID hit, and people are pulled in different directions. So I think that was the overarching theme to the barriers and kind of the status of where folks are at now. One interesting thing, I did a quick poll, and it seemed about 1/3 of the people in my group were part of developing the MOU. The others weren't, so kind of had different roles. We also discussed a little bit about the challenges, the information challenges, and the challenges when there's existing MOUs already, and if those conflict with what the MOUs that they want, that they're looking to develop, or do they fold those in? And then also we discussed of who do you reach out to when you do have questions related to system of care or the challenges that are happening. And so that's a little bit about what we had a chance to discuss.
Excellent. So any more from group 4? Was there somebody else with you, or should we move to group 5?
One thing I remember, I had people coming in and out, so I'm not sure if who captured what, but one of the the solutions to for one of the counties was, they instantly went all virtual and, started meeting through Zoom meetings and just kind of adapted that way, which I'm sure is what we're all trying to do now, right? And that's it for our group.
Great. Okay, how about group 5, last group?
So I ended up with group 5, and Paul, thank you for being my note taker during that time. And so something that did come up for us is that when talking about the process, folks identified that not sure, not being able to identify who are the right people to bring to the table, and being able to connect with them. And so I'm putting in here in our chat our email address that you can reach out and email us. Because if you're in a county or within an agency and you're not sure who to connect with, please reach out to us because we can help you in that process. But that was one of the barriers or challenges that was identified along with COVID. I think one of my favorite things that we started to talk about was that the MOU itself is much more than just this piece of paper you turn into the state. It's really about re-innovating the systems that serve children and how they can really integrate that work and work together. And I think, Judy and Allison, some of you may have caught the end of that, but they really described it beautifully when they talk about really we have to take a look at what do we want the services to look like, and not so much from the point of view of child welfare or behavioral health or regional center or education, but really collectively, how do we want the services to happen? When are we able to put into place things that are more preventative so that we're not waiting for the children to, we have to come in because there's a safety reason and remove them from their home. And then I love Allison's addition of, really taking a look at what is the family's experience with our systems. And how can we develop that in a very trauma-informed, family-friendly way where we listen to the voice of the children and the families that we're really here to serve. So, those were just some important takeaways that came from our group discussion. I really appreciate those that did participate. I did find it interesting that there was about only 20% or just over 20% of our group that were aware of the MOU. And so I encourage them all to go back, email their supervisor, go have a discussion with their leadership about what is that current MOU, what are we doing, and how can I help in the development? Because this really is from that ground floor up, changing how we provide services to our children and families. Paul, was there anything else you wanted to add?
I think you've captured it sufficiently, Diana. Thank you.
Excellent. Well, it sounded, sure. It sounds like all of the conversations in each breakout room was really robust and useful. So we are going to offer some time for some questions. If there's anything lingering, additional thoughts or questions from for any of the team members, you can either chat in using your chat window, or you can we can unmute yourself. You can unmute yourself and ask.
Nancy, I will just say we had a question in our chat box about agency or the California Health and Human Services Agency, if whether or not they plan on posting the MOUs once they're completed. And the answer to that is yes. The plan is once we have all of them submitted to us, then we'll do a mass posting of all of the MOUs. And so I think that, you know, kind of threaded throughout this conversation today, I've heard a lot about, you know, linking that MOU to like what's actually happening for the people that are doing the work, and, you know, the ways that families and children and youth are experiencing our service systems or experiencing, you know, our system of care. And so, so once those go up, it will be a great way for us to be able to kind of help, again, make those connections between what the MOU is and, you know, and then the people that it's actually impacting. So once those do go up, we will we'll let everybody know. So closing that feedback loop for sure.
Excellent. Great. Any other questions or thoughts? Okay, then we will, let's see, I'm going to share my screen. So do you all see a screen that says resources? Awesome, thanks, excellent. So,
So Nancy, this is Renzo. Sorry, I was having a hard time unmuting myself. I just wanted to share a question that came out of our group that Damon posed. Sure. And it was in regards to how do you strike a balance within the ILT when there are certain questions that come up that do not necessarily involve all the system partners that make up the ILT. And we really didn't have a chance to fully address that. So if there are folks out there that are members of a functioning ILT that are challenged with that particular scenario, if they could share that would be great.
Renzo, can you repeat that question?
Sure. The question was, in this particular example, the ILT, their ILT is meeting, but sometimes there are questions that come up that aren't, that don't fully involve all the different partners within the ILT. So how as an ILT would we deal with that to make sure that our engagement continues and that we don't lose the participation of those members that are not directly impacted by certain scenarios or questions? I hope I'm phrasing that correctly.
Well, Richard, I would just offer, I guess, while folks are pondering, I would love to hear if there are reflections from folks in local systems for sure. But one of the thoughts that come to my mind is that on a certain level, the formulation of the interagency leadership team agenda requires a fair amount of kind of collective sophistication. So there are issues amongst the system of care involved parties that may not be universal, and if it's an item that is kind of less universal, or can be solved between two partners, or if it's really one of those challenges that is very unique to one sector, it may not be a conversation point within your interagency leadership team agenda. So you solve it offline, right? You use some other vehicle of communication and engagement to deal with the issue. So use that agenda to coalesce around issues that are kind of jointly held or collectively held to the system of care, and feel free to use other mechanisms to solve other issues. The second reflection is, and at the risk of confusing the first part of that answer, on some level, almost every issue can involve partnership, and if nothing else, sometimes our interagency leadership team partners might have a perspective or an experience that would be similar to the challenge that the more limited partnership may be experiencing, or the one partner might be experiencing. So using that ILT as an opportunity to get to brainstorm. Listen, this is my challenge as the department head at child welfare. I got this problem, and I know it's mostly my problem, but this is what I'm facing. Can you all help me with it? And just putting it on the table in terms of an opportunity to brainstorm what might be possible based on other people's experience can be powerful.
Looks like we have another question in the chat box.
Yeah, what is the link? So this next piece, if there are, if we're moving on to resources, although if anybody has any additional questions, I think that we can take them. But question is, what's the link to the cross-system collaboration tools referenced on the slide? So all of these slides, they're hyperlinks that once the website and once the PowerPoint is posted, you'll be able to go there. But we can also chat in the website. And that's what Christine is on it.
Yeah.
Excellent. So Diana, oh.
Sorry, if the question is specific to the second link under other resources, the CalSWIC, if that's the question, that just for elaboration on that, underneath the KDA settlement and relative to the core practice model evolution, the folks at CalSWIC have been a clearinghouse for some of those tools. So it's just an opportunity for emerging system of care partners right now to avail themselves of the tools that CalSWIC is hosting right now, vis-a-vis core practice, vis-a-vis the prior efforts to link systems in California, if you will. And it looks like Christine's just posted that link. So just for clarity, that's what that is, that second link there and other resources.
It's the longest link I've ever seen, Christine. We're going to make sure that's the right one.
I'm gonna do it a different way because I pulled it straight from the PowerPoint. So it's being funky. So let me redo that.
Okay. We're not going to read off that link.
No.
And then Ashley posted where all of the PowerPoints are going to be housed on it's the chhs.ca.gov system of care site. That's where you'll be able to find the PowerPoints. And then Diana, do you want to say anything more about these resources that are available?
So the only thing that I would add is currently, because we do have PowerPoints that are already posted, you can go to our July PowerPoint and click these links and have access to all of these resources immediately. So you don't have to wait for this particular webinar to post.
Good point. And also I would just highlight, which we don't really talk a lot about, but those system profiles, those are links to system profiles. Those are also on the agency website. And those are like really kind of great, like snapshots of each of our service systems. So, you know, when we're thinking about cross-training our systems and again, building those bridges between our kind of internal silos and our external silos, these are like really great, you know, to like hand out to new service coordinators or social workers that are going to be working with families to just kind of help them have a quick understanding. They're pretty palatable and digestible. Of course, we're always open to feedback and input. So if you read it and you're like, this doesn't read right, we're always open to multiple iterations to make sure that we're, you know, really meeting the needs of the community. But yeah, those are really great kind of, I think they're like 1 or 2 pagers depending, to kind of just get familiar, you know, for the regional centers. If you're curious about regional center eligibility for early start or things like that, it just kind of gives you that quick information. So kind of neat resource to share out. So take a look at those too.
Thank you, Christine.
Great. Next slide. Should we move forward,
Yeah,
Diana? Okay.
Please. So I think as we come to the end of our PowerPoint, one of the things that we want to reach out to you all, which I'm going to say, Twyla and Judy, I'm going to be reaching out to you after this, this webinar. So we would really like to ask counties and local agencies in their integrated leadership teams to just be a part of these webinars with us and present what the work that you are doing at the local level, because that's where I feel that other counties are going to learn from your efforts. And so, you know, we do have the ICPM, the Integrated Core Practice Model, that'll be presented next month. We have some data sharing at the micro level and macro level that will be October and November. And so, you know, we're really calling for presenters to come and be a part of our webinars. And so please look at these areas. And if you feel like within your local ILT team, you're doing well in some of these areas, please reach out to our System of Care email and express your interest in helping us with our presentations each month. So thank you.
Excellent. I might also add our next slide is with the September 2nd will be our next date for our next webinar, but that we might potentially consider with this meeting format, instead of going back to a webinar format, the meeting format allows for a lot more interactivity with participants and also allows us to use the breakout rooms. So with that, I am going to ask for your patience for everybody on the webinar right now, because you all registered for a webinar for the rest of the year, and we might be changing that over to a meeting, which means another registration link. So just bear with us as we make those decisions around the different features of the webinar versus the meeting. So don't be totally surprised if you receive an email asking you to register again, but we'll try to make it as painless as possible. And if you have any thoughts about the interactivity, if having the breakouts was useful for you, then that would be helpful as well. Good information for us to have moving forward. And I think with that, that's about it. Christine, Diana, Richard, Renzo, Teray, anybody else have any last thoughts before we say farewell?
I just want to thank everybody for participating today. And Nancy, thank you so much to you and your team for really helping us through this process with this new system.
Absolutely. Yeah. Our pleasure and our honor.
Much
Yeah,
gratitude.
Yeah, I just also want to thank people for their time, for, you know, being brave and sharing, and we really appreciate that. This is really what we're counting on to so that we can learn from each other and also kind of figure it out together, right? So thank you everyone for joining us today, and again, thank you. We know your time is valuable, and so we appreciate you being here.